This is Akashavani Mangaluru. Dear listeners, in today's Talk in English program, Dr. Rayan Charles Mathias, Student Councillor, Manipal Academy of Higher Education, MAHE, Manipal, will now speak on the topic Impacts of Covid-19 Lockdown on Education and Mental Health of the Youth.
Let me give a brief background which will help you to brush up the consequences of education system underwent during COVID-19 pandemic. As we all know, education is the most important weapon for every nation to progress and flourish. Due to coronavirus COVID-19 pandemic, the Indian education system is facing major challenges. There is a major setback to the systematic method of classroom learning. Further, leading academicians, parents and students face multiple issues in adopting the present situation. Through this small discussion, an attempt is made to know how COVID-19 is creating challenges among the system and the society. It also focuses on challenges faced during technology adoption, education, learning process, students' engagement, and the awareness of parents through the pandemic. The COVID-19 pandemic has stirred up the world, and its overwhelming impact can be seen from micro to macro level. That is, from an individual's day-to-day functioning to the broader level like health sector, finance sector, and of course the education sector. The younger generation is considered to be the torchbearer of the society. As such, their nutrition, health, safety, and providing education for a holistic development being a basic essential needs should be a prime concern for policymakers and all nations worldwide. Every industry in the globe is seeing the effects of COVID-19 pandemic. This has a significant negative impact on both the Indian and global education system. It has imposed a global lockdown having a highly negative impact on students' lives. All educational activities were stopped in India as around 32 crore students left their current school and universities according to the data. As you all are aware, Indian government had announced the lockdown and closure of educational institution as a logical solution to enforce social distancing within communities. The nationwide lockdown had a tremendous impact on the education system of the country, especially for students from rural areas, since the Indian education system is dominated by classroom study. The present scenario has made the functioning of the educational institution go very difficult. All educational activities like examinations, school admissions, entrance tests of various universities and competitive examination and others are being held during this period. As the days are passing by with no immediate solution to stop this outbreak, the closure of schools and universities is hugely affecting the learning across the country. The structure of Indian education system, that is, learning methodology, teaching technique, and assessment methodologies is quite affected, resulting in shift to online education. Most focus on virtual education to accomplish the set aims and objectives, but only a handful of schools and universities could adopt such methods, and the low-income private and government schools were quite inefficient to adopt the same, thus resulting in a shutdown. The COVID-19 epidemic has shown us that change is unavoidable. It has acted as a stimulus for educational institutions to develop and choose cut-edging platforms and methods. The education sector has been working to survive the crisis with a new strategy and digitizing the difficulties to remove the pandemic threat. At the end of pandemic, there was a stark decline in education quality across the country. An assessment of students from grade 2 to 6 revealed that they lost at least one specific language and mathematical ability respectively. It is estimated that only 27.5% students had access to digital devices when schools switched to digital mediums. Among those who were part of digital classes, only 15.8% found the online learning experience to be good. Teachers too were unprepared for these virtual classroom interactions. Poor internet connections and lack of access to digital devices excluded marginalized students from online education. While it is difficult to gauge the real time impact of repeated lockdown on the education sector because the latest available comprehensive official data dates back to 2019 to 20, where the survey says the annual status of education report, that is ASER 2021, which has assessed the impact during the pandemic for education sector in rural areas and found that children aged 6 to 14 years not currently enrolled in schools increased from 2.5% in 2018 to 4.6% in 2021. Let me discuss now the challenges faced by institutions, students, and parents during this pandemic and its impact, which we can observe even now. Primarily, considering the institution, mainly observed problems like financial crisis, technical skills of the faculties, reduced admissions, lack of cooperation from parents, fall in admission of international students. Challenges faced by faculty members like lack of infrastructure facility, lack of technological skills, difficulties in content delivering, engaging students, and fear of layoff. When it comes to students, challenges faced by the students like uncertainty with respect to future, poor internet connectivity or networks, lack of support from parents. Challenges faced by the parents are managing busy schedule. Due to COVID-19, parents started working from home and they find it difficult to manage kids' online sessions, manage household work and office work simultaneously. They can't focus on kids with full attention. Illiteracy among parents. The majority of Indian parents are from a rural background, are illiterate, but they want their children to attend schools to get education. Since the school and colleges were shut, parents found it difficult to teach kids at home and help them with modern gadgets. As I said earlier, the pandemic has affected every walk of life, and mental health is not an exception. Unending vacation and leaves of the educational institution were taxing our students' mental serenity and mental peace. And among those, adolescents were more susceptible and vulnerable. A study done by the Center for Disease and Control and Prevention found that anxiety has been diagnosed in around 4.4 million adolescents between the ages of 13 and 17 years. 1.9 million adolescents have been diagnosed with depression because of home quarantine due to COVID-19. Along with this, students are missing out a balance between study, work, and play, and that is very serious. Students were getting signs of irritability and mood swings. Students were having anxiety and low mood. Their dependence on video game and mobile is worse. They were inclined towards emotional eating or excess eating to cope with emotions such as frustration, depression, and stress, increasing anger outburst, low motivation level, and online socialization. Here, I would like to add that students and their parents were not able to recognize the symptoms of mental health issues. Sometimes it is named as bad mood or low mood. It is also important to realize mental health and its treatment. It is evident that the impact of coronavirus will remain for years. Indian students, teachers and parents were not habitual of virtual classroom. Traditional classroom was the only way of learning for them. But now, suddenly, Indians have to shift their traditional classes to online classes. Thus, the system required to work on our teachers' training for online classroom too, so that they can teach the students more effectively and build our future generation. India was not prepared for these dramatic changes, so it was a big challenge for our nation's population. School administrations are required to train their teacher to the level that enables the smooth online learning system. From the future point of view, virtual classes will definitely contribute to our nation's educational growth. We should support our government to adopt online classes and help our students to give them the best future. Along with this, introducing life skill and soft skill education as a part of academic curriculum, and every institution should take a major responsibility in taking care of mental health of their students by appointing mental health professionals. We still observe rise of mental health issues among students. To mention, the concentration level of students has come down. Addiction to social media is increasing day by day, and it is creating a major problem. Further, it is observed lack of academic interest, difficulty in choosing the stream, rise in addiction level are also adding. You're all aware, after COVID, students' mentality has changed. Online classes, spending time with modern gadgets, online texting, making online friends are creating major mental health issues among students. There is a strong need of changing academic curriculum and bring new systems which should help our students to think logically, act smartly, and lead a better life. It is also noted that day by day our students are becoming sensitive and they find it difficult even to face small issues of their life. Because of all this, you might be knowing the suicide rates are increasing day by day. You're all aware our country has got few taglines like India is capital of diabetes, India is capital of mental health. Very soon, we all will hear a news that in India, depression cases are increasing among young population. This will be a dangerous news for us because if you read news day by day, depression cases are increasing, suicide cases are increasing, and very soon a new tagline we got that India is going to be capital of suicide. So the kind request is that let us try to advance our syllabus which will help our students to handle life, balance life, face life, and ultimately lead a good life.
Dear listeners, you have just heard Dr. Rayan Charles Mathias speaking on the topic Impacts of COVID-19 Lockdown on Education and Mental Health of the Youth. This talk came to you from the studios of Akashavani Mangaluru.